This is the SFY 2026 Substance Use Prevention, Treatment, and Recovery Services Block Grant for Primary Prevention Programs pre-application webinar. Thank you all for joining today. The Idaho Office of Drug Policy, or as most of you know, ODP, is excited to announce the State Fiscal Year 2026, or SFY2026 funding opportunity for the Substance Use Prevention, Treatment, and Recovery Services Block Grant for Primary Prevention Programs, also called the SUPTRS Block Grant. Before we get started, I just want to note that the SUPTRS Block Grant is federally appropriated funding from the Substance Abuse and Mental Health Services Administration, or SAMHSA, and ODP is a government entity, and its grant awards are contingent upon funds appropriated by federal funding agencies and the Idaho legislature, funds granted by the federal government, or both. So we'll get started with that. Awesome. So on today's agenda, we're going to start off with some ODP introductions, and then we're going to review the funding opportunity and the application process, go over the application sections and tips and what's eligible and what entities are eligible to apply, and as well as the application support resources, and then we'll end with a Q&A. So we can start off with some introductions. My name's Jessie Dexter. I am the SUPTRS Block Grant Project Director here with Idaho Office of Drug Policy. I've been here almost 5 years. I originally started off in the program planning position, or program specialist position, before transitioning into this role, I guess 3.5, 4 years ago. And I'll kick it over to Marianne King, our director.
Hi, everyone. Good afternoon. I'm Marianne King. I serve as the director of the Governor's Office of Drug Policy. I started out at the office in 2012 in Jessie's position running this grant. And so it is amazing to see the progress that has been made with this grant, the reach and the opportunities that continue to be made available in communities across Idaho as a result of this funding. So we are very grateful for your interest. We look forward to helping you in any way, shape, or form that we can in getting an application submitted and answering any of the questions that you might have. So thank you, appreciate it, and look forward to getting this going.
Thank you, Marianne. And I know we also have Grace and Hannah on the call. There are other 2 ODP staff team members, but if you guys are able to introduce yourselves and are interested and would like to, you're more than welcome to unmute and turn on your camera or whatnot and introduce yourselves. Grace, I see that you're on the call.
Yeah, we had some headphones issues, so there's 2 people here. Yeah, my name is Grace Tucker. I'm the research analyst for the Idaho Office of Drug Policy. This is my first big girl job after graduating from the University of Washington. So yeah, I've been here for almost 1.5 years at this point, and I just do a lot of the data collection and dashboard management, and manage a couple work groups across the state. So that's my role here. And then this is Hannah. It's her first day.
Yes, so I don't have much of an introduction. I am starting today as the programs coordinator. So
yeah, awesome. Thank you, guys. Yeah, Hannah is fresh in her computer, and so there are some technical issues, but it is her first day here. And so we're really excited to have her on as the program planning specialist. And now that she's here, we're full staff. So that's very exciting. So thank you, guys. Okay, awesome. So now we'll go ahead and get started with the rest of the webinar. Oh, and please note, if you have any questions during the presentation, you can go ahead and throw those in the chat. I'm keeping an eye on the chat as we go. And then we can also have a Q&A at the end where you can unmute yourselves and ask any questions. If you want to just unmute yourself and ask any questions as we go through the webinar, you're more than welcome to do that as well. Okay, so now we're going to review the SUPTRS Block Grant funding description, eligible funding requests, and eligible applicants. I'm going to go over this briefly in the slides, but there is significantly more detail provided in both the notice of funding opportunity and the application guide. And you can find all of these resources and more on the SUPTRS Block Grant Application Information webpage, which is on ODP's prevention website. And the link for that webpage is provided in this slide. I'll also take you to that webpage later today or later in this webinar, so you'll be able to see exactly how to find it. Okay, so again, this is going to be a brief overview. We tried to provide a lot of additional information and context in the Notice of Funding Opportunity and the application guide, so be sure to look those over for additional context in all of this. But we will start off with a review of the funding description. So again, the SUPTRS block grant is federally appropriated funding from the Substance Abuse Mental Health Services Administration, or SAMHSA. And the purpose of the SUPTRS block grant primary prevention funding is to support organizations and agencies with the implementation of evidence-informed, community-driven primary prevention programs and strategies that are designed to address specific, locally identified drug and alcohol-related challenges at the state, county, and community levels. ODP and federal block grant regulations require that SUPTRS block grant for primary prevention funds be expended solely on primary prevention efforts. The primary prevention of substance misuse involves programs and strategies for individuals that are not identified as in need of treatment and includes activities that shift focus upstream to educate and support individuals and communities to delay the initiation of substance use and prevent the development of substance misuse behaviors and the onset of substance use disorders. This funding may not be used for substance misuse intervention, treatment, or recovery services. Eligible applications will propose efforts and activities that focus on the implementation of evidence-based, evidence-informed, or promising programs and practices that align with one or more of SAMHSA's Center for Substance Abuse Prevention, or CSAP, 6 identified prevention strategies, which include prevention education programs, positive alternatives, information dissemination, community-based processes, environmental strategies, and problem identification and referral. And we'll go into a little bit more detail on those in a bit. So those strategies, it's SAMHSA's Center for Substance Abuse Prevention, but it's the 6 CSAP prevention strategies. That's how they're referred to. Okay, as we just discussed, eligible funding requests must focus on the primary prevention of substance misuse. Additionally, to be eligible for funding within the application, applicants must, 1, identify substance misuse problems and the related harmful behaviors that are being experienced locally, determine the perceived root causes, risk factors, and protective factors associated with the identified substance misuse problems, and provide supporting data that substantiates the existence of the identified problems, causes, and associated factors. And 2, they must request funding to implement promising and evidence-informed programs and practices at the state and/or local level to address the identified substance misuse issues and the related risk and protective factors to delay the onset of youth substance use initiation and/or reduce the risk of substance misuse behaviors. Eligible funding requests should include the proposal of activities in one or more of the 6 CSAP prevention strategies. Within the application, applicants have the ability to request funding for up to 5 different programs or activities. However, you do not need to request funding for up to 5. Obviously you have to request funding for at least 1, but then you have the ability to requesting for 2, 3, 4, 5. It's whatever your organization has the capacity and the plans and desire to run with. The number of applications or programs you request funding for in your application will not affect your application score, and it doesn't increase your likelihood of receiving funds. So don't feel like you need to request funding for 5 programs to increase the likelihood of receiving funding. That is not the way it works. You just have the ability to request funding for up to 5 different programs or activities. Your likelihood of receiving funding is dependent on the quality of the application that you submit. And the information on the planning, implementation, and budget for each of the programs that you request funding for. Okay, so I'm going to provide a brief overview of the 6 CSAP prevention strategies as well as some examples of what those involve. But again, this is going to be brief. More information about this can be found in the Notice of Funding Opportunity, the application guide, and SAMHSA resources that we will provide to you guys. So 1 is direct service education programs. These focus on interactive two-way communication between instructors and participants of evidence-informed direct service programs and curriculums that are aimed at increasing knowledge and improving critical life and social skills to prevent substance abuse. Example activities include youth-focused evidence-informed programs, such as school and non-school-based educational programming that emphasizes skill building in areas such as decision-making, refusal skills, critical analysis, communication, resiliency, and stress and self-management, as well as parent and family-focused evidence-informed programs, which involve focus on strengthening family bonds and fostering a supportive environment. These provide parents with education and tools to increase positive parent-child engagement and help them effectively communicate with their children about the risks of drug and alcohol and establish consequences. And this also involves evidence-informed programming for an identified at-risk population to address an identified substance misuse issue and the related factors. So if during the application or in your community, if you know that there's a specific population that is at risk for substance misuse that you want to do prevention with, you can also do a direct service education program specifically for that population. The second CSAP strategy is positive alternatives, and this strategy focuses on providing activities that exclude alcohol and drug use to offer constructive and healthy alternatives to substance use, particularly for youth and other at-risk populations. These activities are designed to reduce risk-taking behaviors, reinforce protective factors, and promote mental wellness. Examples of these activities include mentoring programs that provide youth with structured mentoring opportunities to receive guidance and support from peers, or caring adults to reduce risk factors associated with substance misuse. Youth or adult leadership development initiatives that focus on cultivating abilities and fostering personal growth to boost protective factors and mitigate risk factors associated with substance misuse, as well as positive structured social engagement opportunities such as community service projects, volunteer opportunities, or drug and alcohol-free activities. Okay, the third CSAP prevention strategy is community-based processes. This strategy focuses on enhancing the ability of the community to more effectively implement prevention efforts, and examples of these activities include needs assessment, planning, and evaluation. So a coalition or community-based organization's efforts around collecting and analyzing data to identify substance misuse problems, risk factors, protective factors, community resources, and gaps in services, and using that data to develop a prevention plan that outlines goals, evidence-informed activities, and performance metrics, as well as regularly evaluating the effectiveness of prevention efforts to ensure desired outcomes are achieved and identifying areas for improvement. And then this strategy also includes coalition and community organization efforts around community mobilization and capacity building. So providing training for stakeholders to support the implementation of prevention programs, as well as for coalition activities that involve local stakeholders, such as parents and educators and faith-based organizations, to collaborate and implement and participate in prevention efforts such as health fairs, public awareness events, and other activities that promote healthy behaviors. Okay. The fourth prevention CSAP strategy is environmental strategies. This strategy focuses on changing the norms and conditions within communities to reduce the risk factors and increase the protective factors associated with substance misuse. These strategies aim to influence the broader population rather than targeting individuals directly. And key components of this strategy include policy implementation and enforcement, so enacting and enforcing laws such as social host liability, restrictions on alcohol sales, and zoning regulations to limit access to substances, changing community norms. Sorry, I'm letting someone in from the waiting room. Changing community norms, so addressing cultural and social norms that promote substance use, implementing public awareness campaigns to raise awareness about substance misuse issues and consequences and correct misperceptions about substance use norms, and reducing access to substances, so encouraging drug-free communities and environments in schools, workplaces, and community events, and limiting retail and social access to alcohol and other drugs through measures like ID checks, restricting sale hours, or banning alcohol at certain events. And lastly, environmental design, so modifying physical spaces to discourage substance use, such as redesigning venues or reduce risky behaviors, or increasing visibility of law enforcement in high-risk areas. Okay. The fifth strategy is information dissemination. This strategy focuses on increasing awareness and knowledge about substance use, misuse, and addiction and their effects on individuals, families, and communities. It's characterized by one-way communication from the source to the audience with minimal interaction between the two. So this strategy also promotes awareness of available prevention programs and examples. And example activities include media campaigns, dissemination of printed or electronic resources, and community outreach events. And lastly is problem identification and referral. This focuses on identifying individuals that either have risk factors that make them high risk for substance misuse, or individuals that have already engaged in illegal or age-inappropriate substance use, to assess if their behavior can be reversed through education, and if so, addressing their behaviors through prevention education. Example activities include employee and student assistant programs, so work and school-based initiatives aimed at identifying at-risk staff or students and promoting prevention education and referral services to address risky behaviors, and prevention screening and referral services. So screening individuals who have engaged in illegal or age-inappropriate substance use, and to determine if their behavior can be reversed through prevention education. Any questions on this before we move on? So eligible applicants include public and governmental entities, including tribal entities such as counties, cities, schools, and school districts, and local law enforcement agencies, as well as nonprofit entities such as youth or community serving organizations and community coalitions. Federal regulations prohibit the awarding of block grant funds to any entity other than public or nonprofit entities. So we are not allowed to award funds to for-profit entities. Okay. Now we're going to go over the SFY2026 application process. We'll go over the application structure, the sections, and application tips in these slides. But again, significantly more detail is provided in the application guide, and that can be found on the SUPTRS Block Grant Application Information webpage, which is again linked on this slide. So the SUPTRS Block Grant application follows the Strategic Prevention Framework, also referred to as the SBF or the SPIF model, which was developed by the Substance Abuse Mental Health Services Administration, or SAMHSA, to provide prevention planners with a comprehensive approach to understanding and addressing the substance misuse problems in their states and communities. We strongly encourage any applicants that are unfamiliar with the SBF to review the SAMHSA resources to learn more about the framework. So if you are unfamiliar with the SBF, unfamiliar with our application, and are still, learning the ropes of prevention, or if this is your first time completing the application, or even if this isn't your first time completing the application, we strongly recommend you review those resources that are linked on this slide. These resources are also linked, as well as additional resources relating to this, the SBF, in the Notice of Funding Opportunity and the application guide. So it's really beneficial to learn more about the SPF model and the value and all of the little pieces that are involved in it prior to going through the application and fully completing it, because the application does follow the Strategic Prevention Framework, and it can be very helpful. While completing the application, organizations will be taken through and required to demonstrate their ability to follow the SPF. And the SPF includes a 5-step process and 2 guiding principles. Both the resources on the screen and the application guide provide detailed information on each of these steps, so I'm not going to dive into them too deeply now, but I'm going to give a quick overview of the steps and the guiding principles. Again, additional detailed information can be found on these resources and the application guide. So step 1 is assessment, and this involves assessing the substance misuse problems present in your community, the risk and protective factors associated with these problems, and the current efforts to address them. Step 2 is capacity. It focuses on understanding the community's readiness to address the identified substance misuse problems, and then building local resources to implement prevention efforts. And step 3 is planning. It involves creating comprehensive, evidence-informed prevention plans to address the identified substance misuse problems. And step 4 is implementation. It involves identifying and then implementing and putting into place a prevention plan to deliver evidence-informed prevention strategies, programs, and policies and practices to address those identified substance misuse problems. And then step 5 is evaluation, which involves assessing both the process and outcomes of your prevention efforts to determine their effectiveness, identify areas for improvement, and guide decision-making moving forward. And then lastly, the SBF has the 2 guiding principles, and those are cultural competency and sustainability. Cultural competency involves understanding the value and integration of culturally appropriate strategies into every SBF step to ensure that your prevention efforts are inclusive, relevant, and beneficial to diverse populations. And then number 2 is sustainability, and this focuses on building an effective system that can sustain and maintain prevention efforts and positive prevention outcomes over time. Okay, so then you could see kind of going over those steps. Here are the application sections. So they follow those SPF steps. Application section number 1 is organization overview. This is just going to be where you are providing information about your organization, including the organization contact information, address, as well as the primary contact for the application and the organization, and then identifying if your organization uses a fiscal agent, and if so, providing that contact information as well. And then community needs assessment. This aligns with step 1 of the SPF. And this is where you provide information on the demographics of your community, identify the problems, substance use related problems that are being experienced locally, and as well as identifying the kind of current efforts that are happening. And then step 3 is capacity building. You're going to share about your organization's experience with primary prevention efforts, the experience of the key staff that are going to be involved in your proposed programs and plans, the prevention credentials of those staff that are involved, and yeah, kind of just the overall capacity of your organization. And also the partnerships and kind of collaborative efforts that you have going on in your community. So sharing what organizations you work with currently or will be working with for your prevention efforts, and then, kind of detailing out those partnerships that you are involved with. And then step 4 is program planning and implementation and budget. So I'll show you the application in Neighborly at the end of this webinar. And there are 4 sections for program, or there's 5 sections for program planning, implementation, and budget. And that's because grantees or applicants can request funding for up to 5 different programs in the application. But this involves the program planning, so identifying what program, identifying the problems, substance use problems and root causes that you're going to address with this program, what program you've selected, your action plan for how you're going to implement it, and the budget that you need to implement the program. And then lastly, there's evaluation, which is how you plan to evaluate your proposed programs, and then also if you have any past outcome data to share. And lastly, there's a sustainability and cultural competency section where you'll be asked to identify 3 action items for both sustainability and cultural competence on how what actions your organization plans to take to ensure sustainability and cultural competency as you implement your proposed programs. There also is, which I forgot to add on this, there's an additional section this year at the very end of the application called additional documentation. And this is where applicants will have the option and ability to upload their insurance documentation, including comprehensive liability insurance and workers' compensation insurance. All applicants that are awarded funds are required to provide workers' comp and general liability insurance to ODP prior to the implementation of services. And so this year we thought, just to try to streamline the process and make it a bit more efficient, we could just ask for those materials up front. If you aren't able to provide them at this point in time or before you submit the application, sometimes there's issues getting the insurance documentation and whatnot. It's not required to provide that information to submit your application and be eligible to receive funds. But if possible, we now have this built into the application so you can provide that up front rather than providing all this documentation later on if funds are awarded. The additional documentation section also includes the ability to upload background check documentation. So all applicants that are awarded funds are required to provide background check documentation for all staff that are going to be involved in the implementation of direct service programs with youth and/or vulnerable adults. Background check documentation has to be current, which means it has to be within the last 5 years. And if you work for an organization that already requires background checks, You can also just upload a letter notifying, describing that you have background checks, cleared background checks on file for all of the key staff for your organization, rather than having to provide background check documentation for each individual. And that just has to be on agency letterhead. And again, more detail on all of this is in the application guide. It is also clearly laid out in the application itself. Background checks, again, similar to insurance, are not required. You are not required to upload this documentation to be eligible to submit your application or to be eligible to receive funding. This is just something that all awarded applicants are required to provide prior to the implementation of services. So to streamline the process, we're allowing you the option to upload it upfront just directly into the application. So that is new this year. Okay, so we're going to go over some application tips to give you some guidance on some of the areas where we see applicants kind of struggle in past years. So for the entire application, we strongly encourage applicants to review SAMHSA's guide to the Strategic Prevention Framework prior to starting and completing the application to help you get a thorough understanding of the SPF. And then we also encourage you to review other resources provided throughout the application guide. So one, review the Notice of Funding Opportunity and the application guide. Those are resources provided by ODP. But then there's other resources that are embedded throughout the application guide that I can show you later in this application or later in this webinar. And that includes resources from SAMHSA, such as the Focus on Prevention, Strategies, and Programs to Prevent Substance Use, resources on selecting best fit programs and practices, and other program, strategy, and IOM category resources to help you as you complete the various application sections. We also encourage you to thoroughly read the questions and the prompts in each section and fully address them in your answers and responses. And we encourage applicants to have someone proofread your application prior to submission to help catch spelling errors and mistakes. Also worth noting here, you can have multiple staff or individuals working on an application in Neighborly, on the same application in Neighborly. And the application guide this year includes a section on how to add multiple users to one application so multiple people can collaborate on an application in Neighborly. We'll show you how to print the application if you want to work on it and then print it and have someone proofread it that way. Or if you want to download a copy of the application to work on it, say in a PDF or a Word, and have your staff proofread it. Guidance on all of that is included in the application guide. For the community needs assessment section of the application, some tips are to fully answer and address questions and prompts. So fully read the prompt, read the keywords of the prompt, and then fully address that. And we also encourage you to use relevant and timely data to support all of your points and notes in the community needs assessment. Also, under causes and factors, consider and discuss the risk factors and protective factors that are associated with your identified substance misuse problems. And then later in the application, identify and address how the programs and activities you're proposing help address not only substance misuse problem, but also those associated risk and protective factors. Okay. Program planning, implementation, and budget sections. So one thing is sorry, I just saw Yunwa put a question in the chat. So Jesse, is the new next year for the insurance and background checks, or is it being able to upload it up front is new? Oh, okay. So Yunwa, the need to provide insurance and background check documentation if awarded funding is not a new requirement. Historically, SUPTRS block grant grantees, once they're awarded funds, they have always been required to provide relevant insurance and background check documentation. What is new is that this year we're providing applicants the opportunity to provide that information upfront within their application. Cool. Okay, so program planning and implementation and budget sections. Some things to be aware of is to be sure you select the correct prevention strategy or the CSAP prevention strategy and IOM category for each of your proposed programs. To help you do this, you can review the strategy and IOM resources provided in the application guide. So I'll show you that later in the webinar. The application guide has additional information on the strategies and the IOM categories, as well as resources where you can learn more about all of those categories to make sure you select the right one. And also under strategy and program justification, it's really important to clearly explain why the chosen program and activity is the best fit for your community needs to address the identified substance misuse problems and the population, and to serve the population the program will be implemented with. So why this program to address your problems or your identified problems in your community? Why is this the best fit and why are you selecting it? And under activity description and action plan, clearly outline the action plan that for implementing this proposed program. So be sure to give us a thorough understanding that you have a plan for how you are going to implement this proposed program. Do you have dates? Do you have times? Do you have locations? How are you going to recruit participants, or how are you going to identify program participants and whatnot? Where and when and how is this going to be implemented? Those are all very important pieces to that activity description and action plan. So be sure to clearly outline that in your application. And then also provide detailed budget justifications. So SUPTRS block grant funds provide funding in 3 budget categories: staff, mileage, and other. And so in each of those budget categories, you have to provide a budget by staff or by mileage or by other, which involves curriculum, supplies, materials, any food or relevant expenses in those categories. And then you have to justify how those expenses are necessary and involved in program implementation to justify the need for those funds. And for evaluation, we ask that or encourage that you clearly outline how you plan to measure the impacts and outcomes of your proposed programs. And if you've previously administered primary prevention programs or received block grant funding in the past, share any quantitative or qualitative outcomes you have from those activities. And then lastly, for sustainability and cultural competence, we encourage grantees or applicants to think bigger than the bare minimum. Explain how your organization plans to maintain the human, structural, and financial and other resources to sustain your efforts in the future. And explain how your organization plans to ensure your programming is accessible to individuals in your community that are across the socioeconomic, religious, and cultural spectrums. I think oftentimes with the sustainability piece, applicants will put in things like an action item will just be hold a fundraiser, ask for donations. Think bigger than that. Like truly, how is your organization moving forward, planning to ensure that you have sustainability in your efforts over the future years? What are those action items that you're doing to ensure the sustainability of your organization? And then with cultural competency, oftentimes applicants will say, translate materials into Spanish, but we encourage you to think bigger there as well. Cultural competency isn't just in the racial ethnicity areas, it's also in that socioeconomic, religious spectrums as well. So how are you planning to ensure your programming is accessible by lower income populations or single parents or the different faith-based communities? So think more broadly about the kind of cultural diversity of your community and how you're going to serve all of these different groups, or what groups are you planning to serve with your programming, and how are you going to ensure it's accessible and competent and relevant to those populations? Okay, so the SFY 2026 Block Grant Award timeline. So the application opened on February 10th. And it closes March 22nd. This timeline is slightly pushed back from past years. Historically, the application opened on the 1st of February and closed on March 15th. But with just some of the federal funding things that were happening just over the last few weeks, we delayed it a little bit till we got a better understanding of what was happening. So again, that application, it pushed the open date out to the 10th, and then we pushed the application close date to March 22nd. So the application on March 22nd will close at 5 p.m. local time. So you don't have to worry about the time zone you're in. It'll close at 5 p.m. your local time. And at what point the kind of portal within Neighborly of how the application is completed will close down. So then after that, between March 23rd and May 31st is the application review period, where ODP will be working with regional review committees to review the all the applications from the 7 different public health regions of the state to review and make funding determinations. And then June 1st is when grant recipients will be notified of awards. And then the SFY2026 grant award period is July 1, 2025 through June 30th, 2026. So our grant award periods align with the state fiscal year. And so now I'm going to show you guys the Neighborly application portal as well as the SUPTRS Block Grant application information webpage. So let me see if I'm just going to try. Okay, so did that change my screen? Let me see. Okay, people are nodding. Awesome. Great. So this is the ODP prevention website. ODP has 2 websites. We have odp.idaho.gov, which is really our website for the public to provide information on substance use prevention related efforts and activities, as well as, substance use related informational resources and whatnot. But for our prevention partners who are interested in or receiving grant funds, we use a second website to share and provide all of those resources to you. And that is prevention.odp.idaho.gov. So that URL is important, prevention.odp.idaho.gov. And then on this webpage, you can find information about our different funding opportunities, primary prevention resources, data and resources, training, prevention specialist credentials, all of these good things. And so this is the website where our grant application information is housed. If you, on the home page, if you click on Substance Use Prevention Treatment Recovery Services Block Grant, these 2 tabs will open up, and you can find all of the application information on this webpage. Oh. Another way to get to this webpage is along this top-hand navigation menu. We also have our grant and funding opportunities listed there. So if you hover over that, you can also get to it by clicking on that menu option. Okay, so this is the webpage where you can find our notice of funding opportunity, as well as our application guide and the link to the application portal and Neighborly. So there's some additional information here. Once this recording of this webinar is all processed and we get it uploaded on our YouTube channel, I will put the pre-application webinar information here. Currently, I saw the SFY 2025 webinar presentation slides and recording, but I will swap these out as soon as I get this webinar recording, again, all processed and up on YouTube. So yeah, I'll send out an email after this webinar with the link to the recording, the PowerPoint slides, as well as all the relevant resources that I've talked about today. But you can also find that stuff here on this webpage under there. And then we also have some additional resources here for you guys to help with the application. So I'll open this up. This is the notice of funding opportunity. Again, you may likely have already reviewed this. If not, it could be very beneficial to review. But it goes over the funding opportunity description, the purpose of funding, as well as detailed funding scope and expectations. So again, this goes over the strategic prevention framework, primary prevention, programs and activities that are eligible for funding, those CSAP prevention strategies, and those in-depth examples of what programs and activities fall under each of those strategies. And then it goes over applicant expectations, which include, collaboration with existing prevention efforts, the implementation of evidence-based, evidence-informed, and promising programs and practices, and resources on how to find evidence-based and evidence-informed programs and practices, how to select best fit programs and practices, and more registries on how to find different potential programs for you to run with. So very valuable resources in here. Identify the proposed activities and prevention strategy and IOM categories. So here's some more links to learn more about the prevention strategies and IOM categories. Participate in data collection. So this is some of the applicant and grantee expectations. And then grant application submission information, application structure and components, the pre-application webinar, timeline, review and selection process, and then award information. So this is a good resource to review. And then also I strongly encourage everyone before you start the application and or while you're going through the application to keep a copy of the application guide, like printed out or maybe just bookmarked on your browser, just to review this. So I think it can be really helpful. I've tried to expand it every year to make it more helpful to applicants and provide more guidance. So hopefully it improves every year and provides more context. And I think every year since I do update it and add more, it means it's changes and is slightly valuable in different ways every year. So even if you've reviewed this in the past, I still think it's relevant and worthwhile to look over again. So this talks about and gives detailed guidance on registering an account and accessing your grant portal. So accessing Neighborly in the grant portal, grant application portal, registering a new account in Neighborly. So if you haven't ever used Neighborly before when you go to complete an application, you will need to register a new account, guidance on that, as well as guidance on how to start a new application, and then continuing on an existing application. Yeah, so this is referring to once you start an application, you can save your progress as you go, log out of Neighborly, come back a week later, and then continue on that application. So sometimes we've had applicants in the past not realize that, or they've gotten confused and they've started multiple applications rather than just starting one and then going back and continuing to work on it. So this gives you guidance on how to start a new one and then also how to continue on an application you've already started. And then lastly, collaborating on an application, how to add users to the application so one or multiple staff can all work on an application together. Then it gives a more detailed overview of the strategic prevention framework. Again, those resources are provided here, and those 5 SPF steps and the 2 guiding principles. And then it provides a detailed application guide where it kind of provides additional breakdown and guidance relating to each application section. So this could be helpful to review to get more context on what's being asked of each application prompt as you go through and complete it. So there's community needs assessment, capacity building. The capacity building section is a little bit different this year for all of our veteran grantees that are applying for funding again. This year, there's some additional conditional logic built in. So when we ask about CPS and PPS credentials, identifying if any of your staff have any of the credentials or if they're working towards them, and if so, uploading any relevant documentation for those credentials. So this provides some guidance on how to navigate that. And then staff qualifications and organization coordination. Then the next section is program planning, implementation, and budget. So this is technically section D of the application. The application sections for program 1, 2, 3, 4, and 5 are all identical. So in the application guide, we just go over section D for program 1, but it involves the planning, implementation, and budget. So it goes over identifying the problems, the root causes of the problems, and then program strategy selection and justification, those resources to help you find programs and activities to address your identified substance misuse problems. Additional resources on those strategies. I think that this could be very helpful. I think a common problem or common error we see in applications is incorrect strategy and IOM category selection. So here we provide additional resources on those CSAP prevention strategies and again reiterate the definition and the example activities that are involved in those CSAP strategies. And then also the IOM category selection. So the IOM category include universal, which is universal indirect and universal direct, and then selective and indicated. These will vary based on what activities or programs you propose to implement and how you implement them. And this is one that I think applicants also often find confusing. So that is really detailed here in the application guide, and there's multiple resources to help you find more thorough understanding of the IOM categories. But basically, the IOM model divides it's the Institute of Medicine model divides the continuum of services into 3 parts, and that's prevention, treatment, and maintenance. And then the 3 prevention classifications are further subdivided into universal, selective, and indicated. And the IOM category is assigned by looking at the risk level of the individual or group receiving the service. So these three IOM categories include universal, which is activities that focus on the general public or whole population group, not a specific risk group, with messages and programs aimed at preventing or delaying the abuse of alcohol or other drugs. All members of the population share the same general risk for substance abuse, although the risk may vary among the different individuals. And so within universal, there's these two, it's like broken down even further, and that's universal indirect and universal direct. So universal indirect involves initiatives that support population-based programs and environmental strategies. So, much broader, the community at large, kind of the population as a whole. And then universal direct is interventions that directly serve an identified group of participants, but those who have not been identified as having any risk factors for substance abuse. So implementing this category provides direct programming to a group. So if you're doing school-based programming with, classrooms, if you're doing parenting classes, these are, those direct service programs and curriculums where you're facilitating that two-way interaction between an instructor and participants, whereas in universal indirect is much more broadly population-based efforts such as information dissemination, media campaigns, things like that. And then the second I1 category is selective. And this is activities that are implemented with individuals or a subgroup of the population whose risk of developing a substance use disorder is significantly higher than average because of an underlying risk factor. And examples of this include doing program with children of individuals with substance use disorders, or doing programming with individuals that have identified higher ACEs scores, or those adverse childhood experiences. And then indicated involves activities implemented with individuals who do not meet the criteria for substance abuse or dependence, but who are showing early danger signs such as failing grades or consumption of alcohol and other gateway drugs. And the mission of indicated is to identify individuals who are exhibiting potential early signs of substance abuse and other problem behaviors, and to target them with special programs. So individuals that are involved in the criminal justice system, or youth who have already experimented with drugs and alcohol, but are not, in the stage of already having a substance misuse disorder or substance use disorder of drugs and alcohol, but they have experimented and initiated use of those substances. So doing some programming to try to prevent misuse or substance use disorders from developing with that population. So again, all of this is in the application guide. Strongly encourage you to reference this when you are identifying the program strategy and IOM category for each of your programs in the application. And then this is some additional context on that strategy and program justification. This is another section, if you remember when we were going over tips, this is an area where applicants often struggle as well. So this is beneficial to review before completing that program justification, because it gives you some additional context as to what we're looking for. How is this program the best conceptual fit, practical fit for your community? How does it have evidence of effectiveness that is relevant to the substance misuse problems you've identified that you want to address? And then it has some resources to help you find more information on program justification, selecting a best fit program, and then providing that kind of backup data to support how you know that this program has evidence of effectiveness and is relevant to the problem you want to address. So that could be very helpful. And then program 1 implementation. So this involves the activity description and the action plans, as well as implementation fidelity. Please note there's resources linked within this application guide to help you learn more about all of these things. So those embedded resources will be helpful. And there's some additional context and information on implementation fidelity that may be helpful for applicants to review as well. Strongly encourage that. And then program budget. So going over the staff budget, how to add a staff budget line item, how to, where to justify, provide that staff budget justification. Same with the mileage budget and the other budget. And then how to enter in your total amount requested for that program. And then how to complete the program 2 through 5 sections if needed. This is very helpful because even if you aren't requesting funding for a second, third, fourth, fifth program, you do still need to go to that application section, scroll to the bottom and click complete and continue in order to submit your application. So additional information on that is shared there. And then the evaluation section. So, describing the difference you expect your proposed programs to make in your community, and then sharing any qualitative or quantitative outcomes you have from past years. Again, additional context and details all provided here. I don't want to read it verbatim, but I think that this could be very helpful for applicants. And then some additional information on sustainability and cultural competence. Strongly encourage you to review this as well, as this is an area where applicants can often struggle. And then that additional documentation section that's new this year. There's some additional context on that, on how to upload it and whatnot, if it's required, all that jazz. So hopefully this is helpful. And then the assurances and conditions that all applicants are required to agree to prior to submitting their application. And then how to submit your actual application. And this is very important. We want to make sure you get your application submitted and completed correctly. So please review this to make sure you have all your boxes checked. And then just an overview again of the application tips that we discussed today with resources relevant to those application tips. Perfect. Okay, cool. So that's the funding opportunity, like that SUPTRS Block Grant application information webpage with all those resources. I also think it's worth noting at the bottom of this webpage, we have publications and data sources. And this is going to be potentially very helpful when you're going through and doing your community needs assessment or different parts of your application and you are asked to provide data. We have data sources here for you to help you find relevant data to help support your application process. So note that that's there in case that's helpful, because data is something that's asked for multiple times within the application. Okay. Sorry, I saw some questions in the chat. Martha, yes, I will be emailing you both a recording of this webinar and the presentation slides and all the relevant resources that we've talked about today. So you will get that in email. And then Jeannie asked, do you have suggestions on local substance abuse data to identify local substance abuse issues and problems? For example, city of Nampa or Canyon County. Yes, Jeannie. So I think that you can find examples of those data sources here. So this could be a great place to start. I think looking over here, this could be very helpful. And I can also share some other helpful potential data resources in the follow-up email. But I think using the publication data sources is a great place to start when looking for data to identify identify your local substance abuse issues and problems. And if you have any other questions about that when you're doing your application, feel free to reach out and we can help you find some additional sources. Okay, next, really quickly, I just wanted to go over show you how to access the application in Neighborly. So this is the Neighborly, ODP's Neighborly homepage, like login screen. If you have submitted an application in the past, you already have an account, so you can just log in. But if you don't have an account, you haven't used Neighborly to do any ODP grant related stuff in the past, you will have to click sign up now to register an account. And then once you register an account, you'll have to get it verified. So it'll send you a verification code. And then if you need additional support on how to register an account, there's some resources right here. Click there. And that's provided by Neighborly. Okay, so I'm going to go ahead and log in. Yeah, my computer gets very slow. Here we go. It gets slow when I'm on a meeting. So this is when you log in, this is kind of what your dashboard, everyone's is going to look a little bit different depending on the grant related activities you've been involved with ODP in the past. So there's these different kind of headers, and these will all be in the same order. So there's continuing an existing application, there's grants, and then there's start a new application. So If you have started an application already and you want to continue it, it will land and appear under continuing an existing application. If you have not already started an application, this whole tab will not even appear on your dashboard. So if this one isn't there yet, don't worry. It doesn't appear until you actually start an application. And then once you do, when you come back to continue working on it, this tab will appear and your existing application will appear underneath of it. And then you can click into that application to keep working on it. If you have received grants from us in the past, currently or previously, then you will have this grants tab on your dashboard and it will list out all of your past grants for you to look at. So if you need to do activity reports or reimbursement requests, all of your current or previous grants will appear here under this tab. If you don't have any past grants with us, this tab will not appear on your dashboard. Don't worry about it. The nice thing about this is all of our past grants, at least since we've been using Neighborly, all of that documentation is maintained on Neighborly. So if you want to look at past applications, you can by just clicking into those, viewing those applications, and you can look at how you answered questions previously. And then lastly, most important one that's relevant to what we're doing here is start a new application. This should be on everyone's dashboard, regardless of your past OEP related grant efforts. And this is where the application is available, and you'll click Start Application. And then you have to provide your organization name. Start application. And it starts off with an application overview, which could be helpful. This isn't going to tell you anything that isn't said in the application guide or the notice of funding opportunity, but again, worthwhile to review. You'll have to click complete and continue. Then it'll dive into organization information. So what is your organization's name, type, address? Do you have a website? Where are you located? What public health region are you in? And then the primary contact. So who is the person that's going to be the primary contact for these programs? Is it the person completing the application? Or is it someone else providing that contact information, title, email, phone, and then identifying if you have a fiscal agent. If you say no, it'll just stay like this. However, if you say yes, conditional logic will have this stuff, the fiscal agent organization information appear. So then you can provide the organization and contact name for your fiscal agent. And you don't have to, another thing to note about the application, you don't have to complete, you can't save, complete and continue a section until all the required fields are filled. You can save as you go. So by clicking save, it'll save your progress. Before you submit the application, you do have to click complete and continue for every application section. So that's very important. You can save your progress as you go, but once you finish an application section, you have to click complete and continue. And that's when over here on the left-hand side, this little green check mark will appear by each application section. And that application, that green check mark is very important because each section needs to be marked as complete prior to submitting it. So you will need all these little boxes covered with green check marks in order to submit your application. But you don't have to complete each section to keep moving forward. So I have not completed marked organization information as complete, but I can still move forward to the community needs assessment, which is where you provide information, the demographics, substance misuse problems, causes and factors, current efforts and resource and readiness. And again, this is all a lot. You can put in stuff and save it as you go and come back to it later. You can print off each step of the application if you want to, by up here in the upper right-hand corner. You can click print step and it'll render, you can have it done in PDF or Word. So that's one way to print off the application. Or you should have the ability right here on the left-hand menu, there's view users and then there's print application. It was working for me earlier. Sorry, Neighborly's being slow. You should be able to print off the application via this button as well. Okay, there we go. So it just uploaded a copy of it via PDF in my to my computer. I know it's frustrating you can't automatically have it download as a Word doc, but what you can do is download it as a PDF And then when you go to save the PDF, save it as a Word doc, and then you will convert the application PDF into a Word document, if that's helpful to you. So just know those are two of the ways to print off. So there's community needs assessment, capacity building. So the new thing this year is that we added in this conditional logic about the CPS, or so have you received funding? There's some conditional logic, so just be aware of that. And then CPS credentials, this varies depending on how you respond. Again, detailed guidance on all of this is laid out in the application guide. Then there's the program planning, implementation, and budget section. All detailed guidance on how to complete all of this is in that application guide. And then there are program 2. Again, even if you don't have another program, like you don't have a second program, you still need to scroll to the bottom and click complete and continue to get that little green check mark. And that's just like a finicky thing within the Neighborly system. We're not able to have you like conditional logic skip past those. So even if you don't have program 3, you just have to scroll to the bottom and click complete and continue. Almost done. And then there's the evaluation section. We broke this out into 2 questions this year. All the information on how to complete this is in the application guide. And then sustainability and cultural competence. Okay, cool. And then I was going to show you if you want to add users, you will do that on this left-hand side. So if you want to add multiple users to this application, or if there's going to be multiple people collaborating on these programs that are necessary to be involved in the funding or the reporting or any of those processes, you can go ahead and add them now. So that's done by clicking View Users and then Add a User. And you just have to put in their name. And it's important to use whatever email address they will use when they create an account in Neighborly. And it ties people to an application by their address. So whatever staff you plan to collaborate with, use their work address, their work email, if that's the email address they're registering an account with Neighborly under. And then once you do this and they log on, then this continuing existing application will appear on their Neighborly dashboard as well. Okay. Go back to the PowerPoint now. Okay, so those are the links for all that. And now, yeah, we have some time for questions. Sorry if anyone has to hop off, you can go ahead, but we can open the floor for any questions. And I'll also take this opportunity to see if Marianne, if you are still on, if there was anything I missed that you thought would be helpful to reiterate or review or go over.
I think you did an amazing job. That is about the most thorough walkthrough of anything I've ever seen. It is incredible. And I think the takeaway is everything is laid out for you. So it looks like it's an awful lot of information and it might feel a little clunky or complicated at this point, but Jesse's does an amazing job of just making sure that you have the information in front of you that you need to kind of walk through and step by step. So I think it's very easily done. A couple quick things that get asked of me a lot is, well, how much money can I ask for? And what we suggest is that you ask for whatever it is that you need to do your program effectively and efficiently. And then understand that this is not an all or nothing grant. So grant review committee folks will take a look at it and they may say, this piece of it makes a lot of sense to me, not sure about this piece. So you could ask for $10,000 and maybe get the 10,000, but you might also get 8 or 5. So be mindful of that as you're doing your budgets. We always say, make sure that you're putting everything in there that you possibly need, and then know that if it won't be, it may not be fully funded, or it could be fully funded, or it could be funded not at all. And that brings me to a second point is the regional review committee. So I think one really unique element of how we do the evaluation and the scoring of our grants is that we go back out into the regional review committees. So into your local area, and we compile people that are involved in substance use, youth programming, parenting programming, to take a look and help us review these. There are folks that are familiar with the local conditions, familiar with some of these programs, and can say yay or nay on, I think this is going to work. I think this is going to be a fit. So when you are writing your application, one thing that I like to tell people is keep in mind that these are going to be read by folks that are looking to follow the dots. So if you say youth alcohol use is a big problem in my area, and then you say, this is how I know it's a problem, and this is what I want to do about it, make sure that it kind of flows, that people who are reading this and might not have a lot of familiarity in all the technical piece will understand exactly what it is that you are proposing. I think we've often had conversations where we have these amazing thorough applications provided, and yet when it's all said and done, reviewers will go, I'm not really sure what it is they want to do. And I think the best way to combat that is to have someone you know read the application before you submit it and make sure that it makes sense to them. I think those are kind of two big takeaways and a couple questions that often come my way. So thanks, Jesse. I think the rest of the information is all right there in front of everybody. And we are, as I mentioned before, really interested in helping you be successful in getting the application in. So please don't hesitate to reach out to either one of us. Happy to help in any way we can.
Great. Thank you, Marianne. Yeah, I think that was a great point about budgets, is that request, kind of like shoot for the stars, request all the funding that is necessary to implement the proposed programs or activities, and try to justify all of that thoroughly in the budget justifications. This is a competitive grant application, and our funding is broken out across the 7 public health regions based on population of those 7 public health regions. So every year, the competitiveness of the application shifts with how many applications and how much funding is requested from each of the public health regions and across the state overall. But it is competitive, so being able to thoroughly justify, like explain what you want to do, how you're going to do it, how much funding you need to do that, and justifying that funding and why it's necessary to program implementation is very important. And I think one other shift this year that I think is worth noting is we did kind of, we've shifted a bit around our strict evidence-based guidelines. So our kind of strict evidence-based program implementation or utilization of evidence-based programs to kind of align with the feedback we're, one, getting from grantees that a lot of evidence-based programs and curriculums are outdated. They aren't engaging with participants anymore. They're difficult to utilize for all these different reasons. We've been sharing that feedback with SAMHSA, and kind of what we've been hearing back in return is to increase our flexibility, or we have been permitted to increase our flexibility around that. And so we broaden it to evidence-based, evidence-informed, and promising practices. So when you are proposing a program, if it is not if you are not able to implement a strict evidence-based curriculum, but you want to implement a program, being sure that you can provide evidence of effectiveness of why is this proposed activity a good fit for your community and the population you want to serve to address these specific problems, and like providing evidence of effectiveness that you know that if you implement this program or activity in a certain way with fidelity, that you will have these outcomes. But we have become more flexible, so you'll notice a change in language around that from purely evidence-based to more broadly evidence informed and promising practices. And I don't know, Marianne, if you want to provide any additional context around that, or if you feel like that was good.
No, I think you were good. Jesse, you did get another question about the time span and how the funding must be expended in 1 year. So if you want to clarify that timeline for expending funds.
Yeah. So this funding is just for activities that occur from July 1, 2025 through June 30th, 2026. It's a reimbursement-based grant, which means our applicants or our grantees implement activities and then request reimbursement for those funds. If there's a significant issue around your ability to do 1 or 2 things on the reimbursement basis, you can connect with us and we can talk about our abilities. But for the most part, our grant is reimbursement based, and it's only for activities completed July 1 through June 30th. Any activities completed prior to July 1, 2025 or completed after June 30th, 2026 are not eligible to be reimbursed with these grant funds. And we only do grant awards 1 year at a time, just because our funding is determined by both the federal appropriation and Idaho legislature's spending authority. So we aren't really able to give or guarantee or promise funding for multiple years. It gets a lot trickier. So yeah, this funding, all of the proposed activities and the budgets that you're going to outline in this application is for funding that you will expend in 1 year from July 1 through June 30th. If you think it would be helpful to elaborate on how you plan to continue on these programs, I think that's where the sustainability section of the application would be really valuable to utilize, of like, that we're requesting funding for 1 year, but we have sustainability actions in place to ensure that we can continue implementing this program in future years as well. Is that helpful, Tanya? Yep. And then, yeah, for future funding that goes beyond this 1 year mark, that's going to be another application. So the next SFY27 application that will open February of 2026. If you are wanting to do programs for multiple years and seeking block grant funding to do that and support those efforts, you have to complete an application every year. Great. Any other questions? Awesome. Okay. Well, if there are any questions, feel free to send me an email. I know there was challenges with the application last year. Neighborly did they updated our applicant portal to make it more accessible, and it created chaos. That update was pulled, and we have not allowed them to try to re-implement that update. They keep promising me that we won't have the same problems, but we are not going to do it until after this application period closes. So far, Neighborly has been really good, and I haven't seen or heard of any issues around using Neighborly this year. It's a really user-friendly software and a grant management system that we've really enjoyed. Last year, we had a bit of a hiccup, but this year moving forward, I think it'll be a lot smoother for everyone. So yeah, if you have any questions related to the grant application or Neighborly or any of that, feel free to send an email. And then I will follow up with you all and send you a copy of the recording and the PowerPoint and all of the relevant resources from this webinar. Yeah, if there's no other questions, then we can go ahead and hop off. But thank you all for coming today.
Thanks, everyone.